Leslie Carpenter. Thank you for taking time out this morning to talk to me from the Iowa State Capitol, where I know we can find you most days of the week, volunteering, dedicating your time to help pass bills, to help those with serious mental illness. As we both like to refer to that as physical illnesses that affect part of our body, the brain. As someone who personally suffers from bipolar disorder, one of the serious mental illnesses or serious brain disorders that affects 22 million children and adults in this country, I'd personally like to express my heartfelt gratitude to you for advocating on our behalf. As a mental health advocate myself, I've found passions such as yours usually starts with a personal story. Can you share with us if your passion is also driven by a personal story?
Oh, yes, it absolutely is. We have 2 adult children, and our daughter is healthy and well, but our son is very, very sick. He lives with a schizoaffective disorder, and we've had to do the mammoth job of trying to get him into treatment and appropriate care for the past 14 years. And it has been unlike any other challenge in our life because it is wound in with the legal system instead of just being a medical problem, right? Which it is. It has been the challenge of our life. It's the first thing that my husband and I faced that we couldn't just roll up our sleeves, do the research for, and help and be effective at getting him the help because of how broken and siloed this system is. So it is very much coming from a personal space where we still have a very vested interest in improving the system for our son, but also all the other people that we have become aware of living like him, mostly untreated and undertreated in our country. So is it personal? Absolutely. But is it bigger than just us and our son? Absolutely.
One of the things I wanted to focus on in this particular talk with you was the IMD exclusion. Can you explain that to us and talk to us a little bit about how this has affected your son and you and your family in particular?
Absolutely. So the IMD exclusion stems from a federal policy that was put in place back in 1965. It was part of the Medicaid Act of 1965 that LBJ signed, which had many wonderful things in it for the social safety network. But it included specifically the IMD exclusion, which stands for Institutes for Mental Disorders. So it includes people with mental illnesses or brain illnesses, and it also includes people with intellectual deficits. And what they did is they made it so that you can't get federal matching Medicaid dollars for any facility with more than 16 beds dedicated to taking care of people with brain illnesses. And this legal form of discrimination that doesn't exist for any other medical diagnosis is still in effect almost 60 years later now. And has it been a major factor? It is, because it prevents those matching dollars for everybody aged 18 to 64 with those illnesses, and it limits the access to care because people have been deinstitutionalized from state psychiatric hospitals. And other facilities are also not able to get the same level of reimbursement if they have more than 16 beds. It has personally affected us in that it's reduced the number of state psychiatric beds in our state. We are ranked last in the country, 51st in the country. And so I often refer to that as being dead last because it does result in people dying. We only have 64 beds for adults and 32 for children across our whole state. And that is really a problem in terms of being able to take care of the people with the most serious of those serious illnesses at the level of care that they need. And it's still in effect and having problems. We are seeing our new access centers that are opening up, which are wonderful. They're limited beds. You guessed it, 16. They need more beds in many of our cities, but they can't get them because they have to go for that level of reimbursement that's available at 16 or less.
So if the determination to receive needed psychiatric care was based on a doctor's expertise rather than this sort of arbitrary law, we wouldn't be seeing the sort of tragic outcome. People would maybe live a life of sort of purpose versus kind of the despair we're seeing. So in your opinion, if the IMD exclusion was repealed by Congress some 56 years later, what type of world would we be seeing for people, not only with serious mental illness, but just for society in general?
Yeah, I think we would see a better world. I think we would see a world with more balance of figuring out the right kind of care that people need all along the continuum of care. That policy caused a huge pendulum swing from everybody being in an institution, which none of us are advocating for, right? But it has swung too far to everybody being in the community without actually having services available in the community that are providing the kind of care that our loved ones need. So the ideal world is to have a few more of those institutional level beds available, but also being able to build out other levels of care all along the continuum. And of course, my dream is to create things like psychiatric assisted living complexes, places wouldn't be the scary, horrible atrocity institutions of the past, but places where we could have a campus and have some acute care beds where people could stay long enough, as long as the doctors felt they should, right? Not just how long the insurance companies would say that they would pay for, but as long as they should, to have their brains actually be stabilized and healed enough for them to learn about their illnesses, and for their families to learn about their illnesses, and then step down that level of care and have those other levels of care available right there in a supportive community environment. That's my dream. And I do believe it is absolutely possible if we can create enough will amongst the people that are in power in politics, but also enough will among the general public to understand we need to find a better balance.
It's interesting because we have these, what you dream of, these beautiful facilities for people who have dementia and Alzheimer's. And, I think about, the IMD exclusion, how discriminatory it is against people with serious mental illnesses, because as you said, we don't have exclusions to prevent treatment, for people who have other physical disabilities or disorders like, heart disease or cancer or so forth and so on. So just speaking of Alzheimer's, for example, we look at the National Institutes of Health, which is our government's largest public health agency, and we look at what they're spending to find a cure for Alzheimer's. And we look at what are they spending to find a cure for serious brain disorders, for example. And they're spending $475 per person on Alzheimer's. They're spending $37 for serious brain disorders. So that's over a 1,300% difference. And I kind of wonder, as someone with a serious brain disorder, it makes me feel like society doesn't care about us, So why is there this glaring mismatch in funding when you look at the fact that serious or psychiatric brain disorders cost this country over $9 billion annually? Why do we have this going on in this country?
That's an excellent question. I hate to say it, but it comes down to discrimination. It is literally a discrimination thing where I think people in power don't think that maybe a cure could be found. I think that is a piece of it. And it's an active discrimination of not enough people understanding that these are brain illnesses that really are no more of a choice. They are not a choice that anyone makes, right? Nobody chooses to have a brain illness. And that's something that we really need to do a good job of educating everybody to understand that these are illnesses. They are not something anybody chooses. And we need to be dedicating just as much, if not more money, because let's think about this. Most of these illnesses come on in late childhood, early adolescence, and early 20s and 30s, depending upon whether you're a man or a woman, right? These people are in the prime of their life. And if we could manage to find cures and better treatments they have the opportunity to move forward and engage and work and be productive, contributing members of our society, just like you are. I mean, you're amazing. And we know many people who can do that. We just need to make that level of care available to people who have more serious forms of these illnesses who currently don't get that level of care. And funding research is a huge priority. The other piece that I would like to say is that we as a society have recognized that it's not okay for grandma to be abandoned on the streets in the middle of winter in her nightie, barefoot, right? Just because her brain isn't working right anymore because of Alzheimer's. We as a society need to recognize that we need to take care of our adult children who have a different type of brain illness, who often are just as unaware of their illnesses. We need to step in and help them too. And for the life of me, as a fellow human being, I can't understand how we can't get that to happen. We need to help get that message across.
No, absolutely agree with you. It's my hope that now that mental health has sort of percolated up into a collective consciousness with the pandemic, that more and more people are aware of how difficult it is to struggle with anxiety and depression, who heretofore haven't had a mental illness. But it is the fact that 1 in 4 Americans do struggle with mental illness in this country, and 1 in 17 are considered to be severe. So I would like to hope that people will care about the fact that we have a chance right now to repeal the IMD exclusion. There are 12 House of Representatives here in California who have a bill currently in the health subcommittee, I believe. It doesn't have a hearing date yet, but it's possible in the November midterm elections it will come before Congress. So I hope that people will start caring more about people like me. And if you could talk to us about if there's one thing that concerned citizens could do to help, what is it that we can do?
Absolutely. If every single person who happens to watch this today were to reach out to their own U.S. legislators, both House representatives as well as senators, because we'd love to get a senator to file a similar companion bill in the Senate, right? Every single person could reach out to their own U.S. legislators and ask them to support H.R. 2611, which is a bill specifically to repeal the IMD exclusion. And just in case anybody thinks that their voice doesn't matter, let me tell you, as a volunteer, grassroots activist, I have to say I've become an activist now. I can tell you that we've changed laws here in the state of Iowa. This year we have bills running to add beds to our state mental hospitals. That's something that I've been told for 5 to 6 years now was absolutely an impossible thing to accomplish. We are about to accomplish that. We can make a difference. It can be one person coming and beating down the door repeatedly to do that. And everybody here can reach out to their own representative. You have that right as a citizen and as a constituent. And I'm begging you, asking you to please step up and go ahead and reach out. It only takes a minute to email your legislators or call their offices, but your voice can make a difference. We just need more of you.
Yeah, no, I absolutely agree. And actually, I was just reading yesterday that someone, the guy who was charged with pushing tragically that woman in front of the moving subway train in 2017 had told a psychiatrist when he was pushed out of treatment before he was ready, that it was just a matter of time before he was going to push a woman in front of a train. And here he did, obviously, and did. And a schizophrenia expert had made a comment in that same article when he was being convicted and will spend the rest of his life in jail, obviously, that people don't just fall between the cracks. They're pushed, basically, between the cracks. They're pushed out the door and they're pushed into the abyss. And I would like to think that we as a society can do better and can start caring about each other as human beings. So I absolutely am going to do personally everything I can, and I hope everybody listening will do the same. And I just want to thank you. I know you have to run into a meeting, but I want to do your thing for us, and I just want to thank you again for your time.
Thank you. Thank you very much. I appreciate it. And absolutely, that case is the prime example of many people interacted with that gentleman over the course of the past years, if not decades. Many people knew he was at risk and needed higher levels of treatment. Too many people, however, threw up their hands and said, there's nothing we can do. Well, what we're asking people to do today is something where we can say, hey, we can do something. So please do join us in this fight.
Thank you. Yeah, I hope they do as well. And thank you again.
All right.
Take
Thank
care.
you.